One of the strangest things about this pandemic is and has been this focus on the fact that people who were obese were at higher risk of severe disease, and yet we didn't focus properly on their health. And what I'm going to be showing you today is another bit of evidence with regards to how important this was, and critically give you some insights as to why. This is another publication, recent publication, Adult Obesity and Risk of Severe Infections, a multi cohort study with global burden estimates. Now, this has just been published in The Lancet, and it seems as though they're catching up with the reality of what really is going on in terms of the health and the well being of the population in relation to the pandemic. One of the most unusual things is that very early on, we were told this is not just the flu, for which I completely agreed. But then it seems as though it was convenient to just treat it like a flu. And for those people who still think that, the evidence that is coming through from this paper is horrific. And it indicates that we must seriously address obesity. What I'm talking about is very important science. And what I want you to do for those people who are struggling with this, where you have to start is with knowledge. And so I've put in the description a really important course that I had done probably 2 years ago. I really hadn't focused on it. And it was about pandemic weight gain and pre-diabetes. And in this course, I look at fat, the physiology of glucose, insulin resistance, what happens about sugar, simple options to overcome insulin resistance. And it was because this was so important. But I think people have now been drifting along with the idea that you can just treat these issues with an injection or a tablet. Obesity is a pretty serious condition. And when we look at the data that came out of this study, and this was a combination study that involved UK and Finland as well. So they were looking at two Finnish cohort studies. They were looking at the UK Biobank data. And what they were looking at was comparing individuals of healthy weight with those class 3 obesity had a 3 times higher risk of infection related hospital admissions. And they suggest that 1 in 10 infection related deaths worldwide might be attributable to obesity. And it seems as though one of the things that was mentioned in the paper is the use of therapeutics to try and address this. It's not that I have a problem with the use of drugs, as I prescribe all the time, but I believe in the appropriate use of medication to try and support the health and well being of the population. Risk benefit. I cannot understand how we would encourage people to use medication when we know they have to address their diet and exercise. These are fundamentals. But what I'll be talking about, even more importantly, is not just the fact that people are probably maybe overeating. It's the reality that for a lot of people, they are eating normally, they are trying to exercise, and they cannot seem to lose weight. And nobody seems to be trying to explain why. And so when I did the presentation, I had looked at some really important scientific points with regards to obesity. Now, what I'll do, because I'm not going through, the presentation is like an hour long, but what I want you to understand is some very important principles with regards to how glucose is managed. So here is a quick example from the presentation. When you eat and you have high quantities of glucose coming into your system, it then goes down into the stomach. It's then absorbed in the small intestine. And there are 3 locations that it goes to: the liver first to rebuild the glycogen storage, skeletal muscle, mainly for muscle and glycogen storage. Up to 90% of glucose that you take in will be going into muscle. And then finally, there's fat. And what is causing the obesity crisis is the fact that fundamentally they are not getting enough glycogen into the muscle and it's being converted into fat. If you don't understand this science, you can't make progress with regards to addressing obesity. This is the point that I'm making, is that if people don't understand that obesity is not just about overeating, it is far more complex. And I'm going to show you something in this paper that they didn't highlight, but I think is really, really important when we think of what happens with regards to obesity and disease. So when they did this study, and I'll just give you a context here. When they did the study here, they were looking at different characteristics in terms of risk for severe disease in terms of obesity. So mycoplasma infections, gram-positive infections, and so on, all the way down bacterial infections. All of these, anything that is beyond this black line indicates a higher risk. Interestingly, TB seems to have a lower risk with regards to obesity, which is interesting. But almost every other bacterial infection has a higher risk. This is the bit I want you to concentrate on now. And I think I'll make this a little bit bigger so that you can see this. When we look at the selected infections here, skin and soft tissue infection, it's way out here, 2.8 times higher risk than if you're normal weight. Now, this bit is extremely important. COVID-19. This is second in line, 2.3 times. When you compare that to influenza, 1.7, you realize that these are not the same diseases. This is part of the point that I'd been making early in the pandemic. Why, in this viral infection, would COVID have such a higher mortality in obese people than, say, influenza or pneumonia? And this is where the science comes in. And these are the points that I want you to understand from the course. So I put some of these together so that you can understand some principles. One of the points, and I'm going to get this slide here because I think that this is really important information. If you get this, you can understand why there's a problem. Essentially, when we look at what happens to glucose, the majority of what you eat in the form of carbohydrate, broken down to glucose, goes inside muscle cells, okay? And it is stored in muscles as glycogen. So if there is a problem with converting glucose inside muscle cells into glycogen, that creates a blockage for where glucose goes. And this is fundamentally the premise of insulin resistance. And the reason why we have that blockage is because of amylin. A lot of people have never heard of amylin. They heard of insulin, but they don't realize that amylin is the brake and it stops glucose converting to glycogen in the muscle. This is central to why most people are obese and they can't seem to fix it. And this is why I said this is a biochemical problem. And trying to overcome it with other drugs without understanding the biochemistry, in my mind, is dangerous. And so the biochemistry tells us that if the glucose can't get into the cells because inside the cells it can't be converted to amylin because to glycogen because amylin is blocking it, the only option is to make fat. And so what you're finding is that a lot of people, even though they're trying to diet, they're trying to exercise, they are just not losing weight. If they don't understand that pathophysiology, it will make no sense. And part of what I cover in the course is not just about what it is, but simple strategies that you can use to, in effect, unblock what is happening in terms of the muscles. And if you can fix that, you can then address a lot of the challenges with regards to weight. In effect, what they have found is that the muscles can only get up to about 70% of glycogen. This 30% just won't get filled. And this 30% then becomes converted into fat. This is why we have an obesity problem. And when you link it to COVID, and this is where the science comes in, because this is what we had said before, amylin has an impact on free serum ACE2. This is the entry receptor for the virus, ACE2. It gets into the cell. And part of the way that the body responds to infection is to clip off this ACE2 so that it's free floating. We had predicted since 2020 that this free floating ACE2 would bind to the virus and trigger autoimmune responses, which was subsequently shown. But the point is that obesity or amylin drives this sheddase, ADAM17, releasing ACE2 in the bloodstream, increasing the risk of immune dysregulation in people who are obese. Here is the final point. A lot of people are only concentrated on severe COVID-19, and they think that because we're not seeing severe COVID-19 anymore, the problem is behind us. But we still have virus circulating. Part of what I'm working on in the background is what do we do, or what happens when virus is still circulating, potentially binding to free ACE2 in people who have already been immune primed, and because their levels are higher because of obesity, what is the disease presentation down the line? These are the kinds of questions that we need to understand, because what it would suggest is that obesity still represents a significant risk going forward, even though they're not on intensive care. The disease presentation will just change. This is the kind of thing that we need to understand and we need to address. So remember, if you're interested, take a look at what we have there in terms of the course. This is important for people who have issues, or if you know somebody who does, help them to understand the science. Final point coming up just shortly, COVID trapdoor, how your immunity gets depleted by repeated COVID infections. Very important, again, tied around a recent paper that we've just been looking at. Lots of work to do. There is so much going on. So much doesn't make sense. My aim is to educate you and keep you in a place where you don't need to panic. You can understand the science of what is going on. Have a great evening. Look forward to sharing more information with you soon.